Hello and welcome back to Conquering Any Disease Seminar. It's day 5, the grand finale, and I'm your host, Dr. Michelle Hamilton. Today's topic covers conquering lifestyle diseases. We'll be focusing on hypertension, diabetes, cancer, and the immune system along with brain health. As we move into today's topic, let us look at some foundational concepts of health. This can be seen as laws and include diet, rest, exercise, water, air, sunlight, temperance, and trust in God. If we practice these 8 laws in balance and harmony, there will be no disease to conquer. Our foreparents back in Eden, even after sin, did not have these maladies we now have, but as time moved on, we moved further and further away from abiding by our Creator's guidance for life on earth. Many people would like to live to be 120 years old or more, but in today's fast-paced world, that's not sustainable. Centuries ago, more people lived simple lives and took forever to eat a meal. The time spent to eat a meal enabled them to break down the powerful phytochemicals they contained, which provided the immune system with powerful chemicals to resist any disease. What are phytochemicals, you may be asking? These are found in all parts of the food most people throw away. These include the rinds or skin and the seeds of the fruit or foods that we eat. We were designed to eat whole foods. Phytochemicals are like spark plugs to your immune system and liver detoxification process. If you were to supply your body with the highest amount of phytochemicals for 4 months, you could completely cleanse your body and blood. And if there is presence of disease, create an environment that they could not thrive in. Unfortunately, our body's army, which is our immune system, is weakened by lifestyle choices such as unrelenting stress, poor diet, a sedentary lifestyle, staying up past 10 p.m., excessive negative emotions, relying on others to protect our health, trying to find a quick fix to health, and lack of faith and knowledge in our body's natural healing ability. For many of you, your cupboards are filled with vitamins or supplements, and many of you are discussing B17, the latest craze for the past 5 years or more. What about the good old days before vitamins? Why didn't our ancestors have a need? Well, many individuals consume supplements as a normal part of their health regime, and one of the main reasons for many is that the foods they are eating do not have enough nutrients based on environmental factors and soil nutrient reduction. Well, that is a fact, but it should not be the main reason to take them. But in fact, you should have a physician recommend them and tell you when to stop taking them. There are far more important reasons to supplement for specific conditions, but this is not a lifetime recommendation. On this note, let's transition into looking at lifestyle diseases. The diagnosis of lifestyle diseases such as obesity, hypertension, diabetes, and cardiovascular disease has been increasing in underserved communities globally. This has resulted in an increase in healthcare costs and has created a disparity in accessing healthcare services in underserved communities. The conventional approach and use of pharmaceuticals to treat these conditions create a cycle of dependence in comparison to alternative medicine. The goal of this series is to highlight the cost-effective impact and the need for alternative medicine to help disease reversal and empower you to make lifestyle changes to aid disease reversal, prevention, and optimize your health. Our first lifestyle disease is diabetes. What is diabetes? Diabetes is a chronic disorder of carbohydrate, fat, and protein metabolism characterized by fasting elevations of blood glucose levels and greatly increases the risk for cardiovascular disease, renal disease, and neuropathy. The most common diabetes categories are type 1 and type 2. Type 1 diabetes occurs most often in children and adolescents. For this reason, it is often referred to as juvenile onset diabetes. Let us look at what elevated blood glucose levels are and how they are determined. First, fasting or overnight fasting. This is glucose concentration greater than or equal to 126 milligrams per deciliter on at least 2 separate occasions. Second, ingesting 75 grams of glucose and glucose concentration being greater or equal to 200 milligrams per deciliter post-ingestion 2 hours after ingesting the meal, and with a sample done 2 hours after that test. Or random glucose test levels of over 200 milligrams or more, plus the suggestive symptoms, which may include excessive urination, excessive thirst, excessive eating, fatigue, blurred vision, poor wound healing, periodontal disease, and frequent infections. Most of these are often manifesting symptoms in type 2 diabetes. Research increasingly indicates that prediabetes is accompanied by serious health risks, especially in increased risk for cardiovascular disease. Individuals with prediabetes often meet the criteria for metabolic syndrome, which is a cluster of factors that together can increasingly and significantly increase their cardiovascular risk. Some of these factors include greater waist to hip ratio and any two of the following: elevated triglyceride levels greater than 150 milligrams, or HDL levels less than 40 milligrams for men and less than 50 milligrams for women, blood pressure levels that are equal to or greater than 130 over 85 milligrams of mercury, and fasting glucose levels equal or greater than 100 milligrams per deciliter. The major risk factor for type 2 diabetes is obesity, or more precisely excessive body fat. Approximately over 80% of individuals with type 2 diabetes are obese and have a body mass index over 30. They have increased adipocytes or fat cells around their abdomen, and they secrete a number of biochemical products such as leptin and free fatty acid and cortisol. These dampen the effect of insulin, impair glucose utilization in skeletal muscles, and promote glucose production by the liver and impair insulin release by pancreatic beta cells. Also important is that as the number and the size of the fat cells increase, there is a reduction in the secretion of compounds that promote insulin action, including a novel protein produced by fat cells known as adiponectin. And this is associated not only with improved insulin sensitivity, but also with anti-inflammatory activity. Moreover, it lowers triglycerides and blocks the development of atherosclerosis or hardening of the arteries. The net effect of all these negative actions of fat cells is that they severely stress blood glucose control mechanism. How can patients who are diabetic conquer their disease? Well, if they are pre-diabetic or type 2 diabetic, this can be achieved within 4 to 12 weeks. Yes, 4 to 12 weeks under the guidance of a naturopathic physician. Although reversal can occur in such a short period of time, the blood test for accuracy, which is the hemoglobin A1C, is done in 3 months. You may be asking, how is this possible? In alternative medicine, we treat the entire person, and identifying triggers in the mental or emotional health in addition to the physical health is vital, as it gives direction for treatment. This is then followed by ensuring you have a specific diet plan with specific protein, carbohydrate, fat, and water intake daily, and includes supplements for nutritional imbalance as a result of medication, unique herbal formulations to reduce dependence on medication, and botanical formulas to address other organ systems that contribute to the progression of the disease, plus any other disease that they are currently diagnosed with. Most individuals will conquer their disease if they follow the plan for 3 months. Others who cheat can exceed 3 months, but will see dramatic improvements as early as 1 to 2 weeks of beginning in natural remedies and lifestyle modification. Now let's move on to hypertension, and let's discuss some numbers, starting with pre-hypertension. This is a range of 120 to 139 over 80 to 89 milligrams of mercury. Stage 1 hypertension starts at 140 to 159 over 90 to 99 milligrams of mercury, and stage 2 hypertension 160 and higher over 100 and higher milligrams of mercury. Elevated blood pressure is a major risk factor for a heart attack or a stroke. In fact, it is generally regarded as the most significant risk factor for a stroke. However, more than 90% of patients with hypertension are classified as suffering from essential hypertension, in which no discernible cause is given. Well, the cause based on our previous presentation has to do with mind-body connection. As we have reviewed over the past 4 days, sickness and disease first starts in the mind. Many patients that walk into my office after detailed analysis learn that stress is the #1 trigger, and we work on coping mechanisms which significantly reduces blood pressure, along with the use of specific vitamins and herbal formulation until there is little or no medication required. I have also noticed that many individuals suffer from what we call white coat hypertension. Yes, meaning that they're always nervous going to see a doctor, and thus blood pressure is elevated. Many of these individuals are placed on drugs without realizing that it's falsely elevated. Each home should have a blood pressure kit and a glucose monitoring kit for self-monitoring. Taking the information I have just shared in order to conquer hypertension, the treatment plan should include an antioxidant-rich meal plan, a balanced meal plan high in fiber, a coping mechanism for stress management, regular exercise, adequate sleep, and specific nutraceuticals to support cardiovascular health based on that individual's need. The botanical formulation varies and are modified based on the daily monitoring of blood pressure. Brain health. Have you assessed your mental health recently? Well, we mainly attribute forgetfulness to aging. The 2 previous conditions we look at significantly causes the death of neurons in the brain, which relay messages and is vital for brain health. Many individuals as they age worry about dementia or Alzheimer's and think it is normal to be forgetful, which is further from the truth. In order to maintain a healthy brain, we should understand that controlling blood pressure and blood glucose levels are important. Additional areas to note include those who go hypoglycemic, those who have food allergies such as gluten, as it increases inflammation in the gut, which affects neurotransmitters relayed to the brain. Stress reduction through coping strategies to deal with stress, getting adequate rest, and routine exercises. All the preceding factors affect our oxygen carrying capacity to the brain. Hypertensive patients eventually have poor circulation, as well as hypotensive patients, which means less oxygen to the brain, leading to cell death. Hypoglycemic patients have low oxygen level, as their energy level is always low and the body is trying to conserve energy, so less goes to the brain. On the other hand, the diabetic who has insulin resistance and blood sugar is always high gets fatigued after a meal, and the brain is then under attack due to excess sugar circulation, aging the brain rapidly. Your brain needs oxygen for energy. If you have any of the following symptoms: cold hands, cold feet, chronic nail fungus, white nail beds, and unrelenting stress, your brain is not getting enough oxygen. We are coming down to the end as we look at cancer. How do we conquer cancer? First, think back on the topic healthy mind for a healthy you. And if you took the time to find and complete an emotional intelligence test, this is where you would start. Every individual diagnosed with cancer based on the type of cancer, has had some emotional experience that was triggered and followed by a lifestyle and dietary choices in later years that increased their risk to develop cancer. You should note that cancer is multifactorial. If you recall the presentation on day 2, which deals with emotion and health and identifies specific organs affected by various types of emotion, you gain some insight. I hope you can see why these topics were first. So just in case you missed them, go back and please watch them again. Don't be fooled in trying to find a quick fix, as there is no such thing. We all have cancer cells, and it's the sequence of repeated assaults that cause one cell to mutate. Cancer is not a single disease. It is a group of more than 200 individual diseases, all characterized by uncontrolled growth, proliferation, and spread of abnormal cells. Diagnosis and treatment strategies vary depending on the type of cancer cells and their location, the extent of total tumor burden, the health and performance status of the patient, and previously administered treatments. Naturopathic medicine has a role to play in each stage of cancer care. The simplest description of these stages can be generalized into the following. We can help with primary prevention and risk reduction, screening and early diagnosis, integrative co-treatment during active cancer therapies, post-treatment recovery support, and long-term secondary prevention. However, prevention should obviously take precedence over treatment. The occurrence of disease is generally thought to involve two compounding factors: genetic susceptibility and environmental exposure to carcinogens. However, as you have listened over the past few days, our health is not just physical, but mental, emotional, and spiritual. It is important that if you seek naturopathic care for cancer, that routine labs are done to assess the effectiveness of treatment. Many individuals use the title naturopathic doctor, however, are not medically trained. A naturopathic medical physician orders routine blood tests and imaging before and during treatment, and is able to explain lab results in details, as these are a guide to see the effectiveness of a treatment protocol. Always remember, your sickness or disease does not define you, and no matter how grim the diagnosis, cancer is just a word, not a death sentence. Finally, some myths and tips for cancer prevention. 1. Increasing your oxygen levels and alkalinity of the blood does not cure cancer. Cancer can occur in both environments. The truth is, we need a balance between acidity and alkalinity, as well as oxygenated and non-oxygenated blood. Do not go to the extreme. 2. Sugar does not feed cancer. This is another false claim. Your cells need sugar for energy, so even if you avoid sugar, your body converts protein and carbohydrates to sugar for energy. However, what sugar does is increases inflammation in the body, and cancer strives where there is more inflammation. Inflammation can also occur from many different things, and as a result, some of these would be poor stress management, emotional or mental health issues, imbalanced diet, lack of exercise, and sleep deprivation, to name a few. Next, a vegan diet is always optimal for any illness, but can vary based on where a patient is in their disease process and nutritional requirements. It is important to explore both conventional and alternative medicine before making a decision on treatment. Both can be combined or used individually, and a good physician will put the patient first and allow them to make an informed decision. I hope today's presentation increases your understanding, and for those who seek hope, you have found renewed hope and purpose. Thank you for joining me over the past few days. I hope you feel empowered to take charge of your health. I am Dr. Michelle Hamilton, and remember, health is wealth.